Am I sitting too close? Am I all right?
Do you feel like you're sitting too close to me?
I don't. I like to be close.
All right, good. Well, then that's because you've been in Florida this whole time.
I know. I brought the sunshine.
You brought, well,
that's already fading.
There is no sun here. Did you forget to unpack it?
I know. I did when I first got here because I flew in on Friday night and it was 75 still at 8:00 when I got here. I was like, yes. And then I was like, Saturday, beautiful. I was like, yes. Sunday, not beautiful. Felt freezing cold at 55. And I was like, oh, reality.
Mm-hmm. Yeah. And it's been that way ever since. So
yeah, but I missed seeing you in person.
No, I missed you too. And I've been, this past week, I've started my exercise routine again.
Oh,
I do a lot of Apple Fitness. Plug Apple. If you're listening, I could use some free anything from Apple. But I hurt and I can't move a lot. So
yeah, that's tough when you start out. It feels good, but it hurts so good, right?
And I'm not overdoing it. I'm taking my time. I'm starting small, but even starting small, my body's like, what
happened? Where's that winter?
Are we still in the cave?
Yeah.
No, but it's all for a good, because I'm not ashamed to say, I think I've gained like 20 pounds.
Really?
Yeah.
I don't see 20 pounds on you.
Well, you're a saint. And
I don't.
I appreciate you and everything, but you're a liar.
I'm not. I don't see 20 pounds.
No, I hide it well. It's all in my legs and my feet. It's all my cankles.
Good. Your cankles? Oh yeah, I did notice those.
Thank you. But speaking of health, see how I did that?
Oh, every time.
Every
Sometimes
time
I do it, and then I'm very impressed with myself. Do it,
but this time I'm doing
it.
We have a really great guest on today. I don't know how we snagged him. He's slumming it today for our little dog and pony show. Today we have on Dr. Joe Sherman. He is a pediatrician, a coach, and a consultant to physicians and healthcare organizations in the areas of cross-cultural medicine, leadership, and provider well-being. He is a facilitator with the Center for Courage and Renewal and a master's certified physician development coach with the Physician Coaching Institute. My God, leave some for the rest of us. Dr. Sherman helps healthcare professionals transform their relationship with the unrelenting demands of their jobs and discover a path toward meaning, professional fulfillment, and career longevity. Dr. Joe Sherman, thank you for being here today.
Thanks for having me. I appreciate it.
We appreciate you. My goodness, that is quite the resume that you have there.
Well, very flowery words to say that I try to help healthcare providers survive and hopefully thrive.
Yeah.
I don't know.
That's one of the reasons I wanted to have you on the show. We met, we were connected by a mutual connection in the networking world. And the first conversation I had with you was fascinating because I've never met somebody who does what you do, which is like, in a nutshell, generally help physicians or people in the medical world with like enjoy their job better and handle stress and like bedside manner and all that stuff. And I know Kristin and I, we've talked about that a little bit on the show.
Yeah, you have to have been even more busy than ever the past 2 years. I can't even imagine. I mean, it's already a stressful line of work, but given COVID, it probably was like on steroids in that way, like trying to deal with all of that.
Yeah, it was. I mean, surprisingly, at the beginning of the pandemic, there were like two groups of healthcare providers. There were the ones that were on the front lines, kind of every day, working their butts off, trying to do everything they possibly could to keep up with everything. And then there was the other group that was on the sidelines, all of the ones that were in primary care, ones that did elective procedures and surgeries. They were kind of like off to the side. So their concern actually was income and how to keep their staff paid and those types of things. So there were different stressors for different groups.
How much of an impact? I know people have seen numbers and statistics on the evening news, but I don't know if you can shed any more light into like how big of an impact COVID really has had on the medical field in the United States.
That's a big question. Yeah.
Thank you.
I love it.
I can say the area that I'm primarily concerned about, which is the well-being of healthcare providers. As far as the impact of that, even before the pandemic, there are surveys that are done for physicians across the board of all medical specialties. And there was a burnout rate that people who are physicians in clinical practice who self-report as being burned out. There was a burnout rate that was somewhere close to 40%. That was before the pandemic.
Wow. And
now, after the pandemic, or at the tail end of the pandemic, or whatever you want to say we are, I don't know, limbo.
Yeah.
That number has increased to as high in some specialties as high as 60%.
Wow.
So that's saying, and I would say the average somewhere between about 43 to 60%, somewhere in there. So that means these are practicing physicians. That means that as you go in, either to see your primary care provider or into a hospital or definitely an emergency room, those specialists at the top of the list for burnout, then for emergency room, about 60% of those people who are attending to you have already said that they're burned out.
Mm-hmm.
They're done.
Wow.
So it's pretty dramatic.
Is there maybe let me say it this way. Before COVID, was there a shortage? Or is it the way the system's set up? Why do you think there's so much self-reported burnout in the medical care field?
Yeah, I think most important is kind of defining what we mean by burnout, because I think people have different ideas, and frankly, I think it's kind of an overused term. I think, but there's classically, it's actually in the DSM-5 or whatever as a diagnosis, which is the manual that behavioral health professionals use. But there are three components of it. The first component is emotional exhaustion. So this is emotional exhaustion of just being involved so much kind of like traumatic types of interactions that you're emotionally exhausted. The second component of it is depersonalization and dissociation. It means that as you're doing your job, all of a sudden, you're no longer having that meaningful relationship with the patient. You're basically just kind of like mailing it in. You're just going through the process, going through the motions of just doing your job. And then the third component of it is this lack of a sense of meaning or purpose in your work. So if you think about being emotionally exhausted, going through the motions, and really feeling like you're not making any difference anyway, that's what's going on with a lot of healthcare providers now. And what's happened is during the pandemic, the big difference now is that there is this new component of all of this of the public, the general public, who is just fatigued by the whole COVID pandemic thing. A lot of times they're turning on the healthcare providers themselves. So something now that healthcare providers report a lot is this this abuse, they would say, either verbal abuse or whatever, by the patients themselves. And everyone's frustrated, and healthcare providers are an easy target to get your frustrations out on.
Yeah.
That's a shame.
Yeah. I was thinking with my therapist hat on that when you went through that definition, which you probably should know if it's in the DSM-5, but that
there will be a test later.
Yeah. Right. No, I didn't know it that well. Like you just explained it nicely, but I think the second part of it to me sounds like a defense mechanism too, that if you're have all that emotional trauma that you're walking around with, then disassociate and just go through the motions is to me, that's what spoke to me.
Mm-hmm.
It's a protective thing. And then it's all connected, right? And then if you're doing that because you're emotionally traumatized, then you're not getting any joy or purpose out of your work because you're missing that personalization that you mentioned, and maybe as much attention to the relationship piece as you were prior.
Yeah, I would say that is exactly correct. I think it's almost like right now what we're seeing is burnout, and part of the burnout is this protective mechanism. Is if anyone who is traumatized, if you can't escape, you kind of like go outside of yourself and just kind of dissociate from the situation. And that's what a lot of healthcare providers have done. But now we're at a phase now where many healthcare providers, I keep saying healthcare providers instead of physicians, because I'm talking about physician's assistants, I'm talking about nurse practitioners, nurses, everybody, including all the respiratory therapists, physical therapists, all the people that were involved in caring for very critically ill COVID patients, that everybody now has a large percentage have moved on to actual clinical mental illness, depression, anxiety. And this is what we're seeing now in the aftermath of the pandemic, and what has been predicted the whole time by mental health professionals and public health folks.
Yeah.
I think it's so sad that, because you have to be a special kind of person to get into any kind of healthcare, but I think surgeons, physicians, like people on the front lines that you were talking about that like help the people as they're coming in, and like you have to be a special kind of person who wants to do that, who loves that kind of work in that kind of field, helping people like that. And to me, it breaks my heart that the people who got into that wanted to be there, who fell in love with it, are now being damaged by that calling that they had, that vocation.
Yeah, it's, my wife, who is a psychologist and a therapist and has quite a few physician clients, and she says to me, if somebody asked you right now and said, really thinking about being a doctor, I would like to go to medical school, what do you think? What would you tell them? And I have to be honest, I still have hope that our healthcare system and the structure of our healthcare system will change, that somehow we will learn from this experience, that we won't have collective post-traumatic stress as a result. Maybe we'll have post-traumatic change. We'll have post-traumatic growth, that somehow through this natural disaster that has occurred, either on a small scale with individual offices or hospitals or healthcare systems, or better at a large scale for a whole healthcare system, that somehow there is hope. So I would say, just be aware with eyes wide open about what you're getting into. Because when you commit to going to medical school and then you get kind of spat out on the other end, it's going to look completely different than when you went in.
Right.
Because it's many, many years later that you're going to come out on the other side. And then she looks at me and she says, you got to tell them not to do it. I can't say that. I don't know. I remember when I was looking at going to medical school, and this was, in the late 70s, 80s. And I would talk to doctors and say, I think about being a doctor. And back then it was, I don't know, because there are these things coming along called HMOs, and these HMOs are going to take over the world, and they're going to tell us exactly what we can or can't do. And that's going to be the worst. And so I don't know if I would go into it anymore. And I was like, I don't even know what an HMO is, and I don't know what your life was. So I'm going to go anyway and see if I can make the best of it.
How much do you think, I may be getting way too philosophical or off track, so reel me in.
Okay, I'm ready.
You're my Jiminy Cricket.
Okay.
How much do you think preventative care fits into this. Like, people are just not taking care of themselves. And so there's more of a strain on our healthcare system because things that may have been easily preventable are now like, oh, I'll just go to the ER. I'll just go to the doctor and I'll take the pills and I'll get the tests, instead of, I'm going to be proactive about my health, barring anything like that's genetic disorders, cancer, like stuff that we can't avoid. But, there's a lot of stuff that I feel like we can. Am I off base, or is that part of this?
Well, I think a lot of it has to do with the lack of relationship that patients have with a primary care provider. And I think that this is something that in my 35 years of practicing pediatrics, I've seen change and evolve over the years. As a general pediatrician, I know that families would come to me if I were in the same office over a period of time. The kids grow up with you as their doctor. The family knows you. So you become not only their medical provider, but you become a resource for advice. You become the advocate for a patient and the family when things go wrong, when things really don't go as planned. And because we have so many different insurance companies and switching from one insurance company to another, and you have to get a provider who's on this panel, and this is this particular provider is out of network or in network. I can't keep up with it as a patient, much less as a provider. So I think we've lost a lot of that type of relationship. Just recently, we were talking before, I just recently lost my brother. He died, and he was older, but he had this prolonged hospitalization. And the whole time I was saying, where is his doctor? Where is his primary care doctor? Who is calling the hospital and calling the ICU and trying to get information and explain it in terms that his wife can understand? And the reality was, there was a primary care doctor, but there's a total breakdown between that primary care doctor in the office and the hospital and what's happening in the hospital. So I do think that things have been compartmentalized in our healthcare system, and there's been a lack of an established relationship between patients and providers.
Mm-hmm.
That's a lot of sense. Yeah. And that resonates with me, because now that I hearing you talk, I haven't had a primary care physician in decades. I don't think. Like,
where do you go to the doctor?
I go to a specific center where I get my health care, but like you said, they change insurance, people come and go, doctors leave, they come back. So I go to the same place, but I see a completely different crew every time I go there. And so you're right. Like, I miss having that. I hadn't had a relationship with a primary care doctor, I think, once I got rid of my pediatrician, once I not got rid of him, but once I grew out of, he's nowhere to be found.
No.
Once I grew out of, going to a pediatrician, I don't think I've had a primary care doctor. Oh my God.
I have one, but I've only seen her once or twice, because it seems when I need to go, I'm sick, and then you can't be guaranteed to see your doctor. But I was just thinking about, I had a specialist doctor, I guess you consider her, and I loved her. She was like, I looked forward to going to the doctor because I would get to see her. And we just had a really, really great rapport. And just within the past year, she retired. I have no idea if that's really what happened, but she all of a sudden, poof, was gone, and no warning. And I experienced this as a loss, like more than I ever thought I would. I was like, what do you mean she's gone? She's younger than me. How's she retiring already? And what's happening? And I literally was like, I got to find her and say hi. It was weird. I didn't like that. I don't know what happens. They said retired. I have no idea. So yeah, I felt that like lost, because I had that relationship. And since then I went back to the same place, and I saw a doctor, and I wasn't like jazzed with her. She was not awful, but she wasn't my doctor. And then I went back again for something else and saw someone else, and I liked her. And so when I called back, like, your doctor so-and-so, I'm like, can my doctor be that woman, whatever her name is? And they were like, yeah. I'm like, I want to see her. But yeah, I'm very much, I guess it's in my profession, a relationship person. And you don't get that very often. You just kind of connected all those dots for me.
And I'm curious to ask you, what is it about the doctor that you did see that made you think, hey, can I see that one next time? Or I want that one?
Less formal, less kind of rigid, just saying what I'm supposed to say as the doctor. She's just kind of more laid back and direct and had a sense of humor, just sort of more personable.
Mm-hmm.
And it wasn't my old doctor, because no one's going to replace her, but it felt comfortable to me. It's not like the other doctor had done anything wrong. I didn't feel anything about it. And maybe I would over time, but we only saw each other once. But I only saw this woman once, and I had a totally different vibe.
Yeah, I think that tells a lot about what it means to have a relationship with patients and doctors. And I think when I know for me as a patient, and I spend a lot of time as a patient now or accompanying family members to doctor's appointments, I really look for people that listen to me, that truly ask me questions that reflect the answers or what I am saying, and not just going through the list that's on the electronic health record. Because as healthcare providers, there's a lot of pressure for us to have all the right boxes checked on our computer and to make sure that we do the right charges and make sure that all of those charts are done and closed and answer all of the inquiries and look at all the lab results and answer and make all the referrals to consultants and all of that stuff, as opposed to sitting down and truly listening to patients and responding and asking questions based on what I hear. So that's often the telltale sign of somebody who's really in relationship and attuned to what's going on with patients.
That really, I'm sorry.
Oh, well, go ahead.
I'm sorry, it like struck a chord for me. I have clients with medical problems, medical conditions, and I can't tell you how many times I've heard the opposite of what you're saying. They're very frustrated, lose faith in doctors, and it's because they don't listen. They don't listen, and they don't. What you have to recognize is in a way, the patient's the expert on themselves, in a way. And even just validating them and what they're saying can go a long way, even if you're like over here, like, that's not it. I've had a lot of people that have strayed away when they needed to be pursuing a medical situation because of their experiences like that. So that makes tons of sense to me.
And I will tell you that if you were to be able to have a conversation with that provider, I say provider because it could be nurse practitioner or PA or whatever, and the one that is distracted, totally focused on the computer and just asking questions that seem to be mechanical, if you were to say, how's the job going? How do you enjoy what you do? How are you getting along with your work and being able to kind of interact with your colleagues? How valued do you feel? And how much do you feel like you are working with a common mission as your employer and the institution you work for?
I'd probably throw them off their seat.
And that, and because what I'm saying is that patients, just like I said from before, when a healthcare provider treats you that way and seems like, boy, you're not listening to me. All you care about is that computer in front of you. I'm just kind of like one more cog in the wheel you're just trying to get rid of. And what's really happening is that provider, in many cases, is being blamed for what he or she is experiencing behind the scenes. And that's what we see. And that's, I think, where I try to work with healthcare providers to kind of say, every now and then, I was like, what is it that you really love about what you do? And many of them will say, I love being with patients. I love treating patients, being in relationship with patients and making that connection. And I just can't do it because I have too many to see, or I have to make sure my charts are done or whatever. And I'll say, how important is it to have that chart perfectly done? How important is it to have that note perfectly written? And every now and then, what's it going to be like if you just go in and say, in this visit, I'm just going to sit and listen to the patient. And I'm not going to look at the computer. I'm not going to write anything down. And maybe I'll have a piece of paper or something. But my goal for this visit is purely to make the connection and listen. And you're going to have so many more satisfied patients if you were to do that than if you had all the boxes checked on the electronic health record.
Yep.
And I'm feeling that, like, my chest tighten up hearing you say, like, I'm just going to sit and listen to you, because that has not been my experience when I see doctors. You're right. They come in, they wheel that laptop on the stand in, and they always look so frazzled. They're like, okay, who is this? Who are you? Great. One time, quick aside, my father and I have the same name, everything, same first name, middle name, last name. I'm a junior, but we go to the same hospital. And so one time I went in to get blood drawn, and the nurse came in with all the test tubes and this notes and everything. And she looks at the stickers, and she looks at me and she looks at the stickers, and she goes, "What's your birthday?" And I'm like, 12/8/75. And she's like, "Who the hell was born in 1933? And I was like, "That's my dad. You may want to recheck your chart." She said, "Oh, okay, I'll be right back." But that's there. I mean, what I got, I'm lucky I was just getting blood drawn and not something else. Like, what if they gave me my dad's, medication or something? So there's definitely, like, danger that can happen if people are so frazzled, they're getting patients mixed up and they're not looking at stuff. So what you're saying is not only a nice thing, nice to have, but in a general sense, necessary to have, right, for safety.
Yeah, go ahead. I'm sorry. Go ahead.
I was just gonna say, I'm learning all sorts of stuff. Just like I'm connecting all kinds of dots right now. This is
great.
No, I was just thinking that's the reason I picked my primary care, because I recently started going to this primary care office, and it's a big hospital and everything, and it's a big practice. But she's a nurse practitioner. I think it was her, because one of the things I noticed right away is when she came in, she was more relaxed, which is good for her. I get it. There's a lot going on, but she didn't rush me. I felt like she listened. I felt like I could ask all of my questions without feeling like I was rushed. I felt like she took the time, and that was why I chose her as my physician. So yeah, that makes so, because I was like, that, and the fact that I had been in other practices that, like, I would get sick and they'd be like, "There's an appointment in 2 weeks." And I was like, "Oh, no. So that was the other thing when I went in. I'm like, so if I get sick, will I be able to come in in the next day or two? Anyway, so yeah, that was what it was about. You almost had to shop around, though, to be able, and I'm lucky because in this practice, although I've seen other physicians, this is different from the other doctor I was referring to, the one that left. It's a different practice. Everyone's been great, and that's why I've had such a good experience. So even when it hasn't been her, I really have liked the people that so that says something.
So that says something about where they're working, and that could be where they're working from a big scale or where they're working just in their location. Because I did a consultation for a healthcare group once that had several different office locations, and I spent 2 days going from one site to the next, to the next, to the next, just kind of like sitting back, watching how people interact and sitting down with the staff. So both all the physicians, the front desk people, the nurses, everybody, and all of the different sites were just like, oh my gosh, there's so much pressure. There's all these new policies and procedures. There are all these little pop-ups that come up on our screens when we're trying to see patients, just so hard. And just, I could feel the tension and stress. And at the end of the day, I went into this office and I walked in, and first thing I noticed was that the entire staff were wearing jerseys of like teams, of like football jerseys or whatever, of different, sports teams, mostly football. And they were all, and I saw them kind of busy, just as busy as every other place, but they, like all of the nurses or medical assistants, they were all asking, can you do that for me? Yeah, I'll go grab that. You want to go get this? And they were all talking to each other and helping each other out. And I kind of looked around and I said, can you show me where the medical director's office is? And they said, oh yeah, it's in the back. You just keep going there and you'll find it. And I go in and I look in the front door, and there's a desk that's right in front of the door. And there is this woman sitting behind the desk. And I said, and I knew that the medical director was male. And so I said to her, I said, oh, I'm sorry, I'm looking for Dr. Jones's office, whatever. And she said, oh, this is his office. And I said, oh, she says, his desk is right there. And it was like another desk. And I said, oh, okay. Well, then she says, come on in. And I said, oh, okay. While I'm waiting, who are you? Are you? She said, oh, I am a nurse practitioner. I just started here last month. I said, oh, okay. They didn't have room for you. They had to put you in the medical director. And she said, no, this medical director, Dr. Jones, everybody who is new, he has sit in a desk in his office so that he is always available to them to answer any questions, to make sure that they have any support that they need, to make sure that they're not overwhelmed and overscheduled, and so that he can be a resource to them all the time to make sure that they make that transition well.
Wow.
Wow.
Oh my God. And then I went in, I talked to the clinic manager, the administrator of the clinic, and I said, tell me what's going on with you all? What? And she said, it's the way that he leads and the way that we work together, that everyone feels supported. We feel like we're valued and that we all have a common mission. And those are the two factors that are the most important for medical provider professional fulfillment. Those two factors, feeling valued by the people you work for and with, as well as feeling like you're working together for a common mission and you're helping each other out all the time in that supportive role.
Right.
Wow. Just good leadership skills in general too. I think that whoever that doctor was a great leader in what he was doing. This is a good way to lead into telling everybody a little bit more specifically about what you do, how you gave a good color to it with that story about visiting the office, but what specifically do you do and how do you help medical professionals?
Well, most of what I do has to do with my direct experience of burnout and of being misplaced in various jobs that I've had as a pediatrician. And I have worked I was just telling somebody the other day, I haven't had one job for more than 5 years. And some of those switches have occurred because of life circumstances, moving to another place in the country because my wife had a different job, or that we decided to move overseas, which we did a couple of times. But some of those switches had to do with me feeling like I'd pretty much played out everything that I can in this role, and that things were starting to change. I was feeling like I needed a change. So somebody else was coming along with more enthusiasm. We'll hand it off to that person. But it did get to a point where I was in one position and I just felt like I was trying to fix everything. I felt, in the culture of physicians especially, is that if there's something wrong, then we feel like we need to do something to make it better. Now, we can complain about what's going on, but in the end, there is this self-critic inside of us that has been very developed during our training that tells us, work harder, do it better. You're the one responsible. Keep going, keep doing it. And I got caught in that cycle until I just went down in flames. And I ended up leaving a job and resigning because the reality was I was depressed and anxious, and I couldn't stay in the job anymore. So I quit completely and really started to look back at my life. And I read this book called Let Your Life Speak by Parker Palmer. And that's where the Center for Courage and Renewal comes in. And this was all about looking at your life and the experiences you've had in life. When have you been most excited, most alive? What have you done where you felt like, oh God, I hope this never stops, or I can't wait to do this again? Because that's what you want to look at. That tells you who you really are. That tells you what values you have and what it is that makes you come alive.
Mhm.
And so I started looking at that and I said, wow, I love being a teacher and a counselor. And I love being this cultural ambassador where I'm in another country and I'm trying to figure things out and help other people figure those things out. And those are the things that really make me excited, and teaching and counseling. And yeah, there's medicine too. As long as medicine included all that other stuff, I was rolling. That was great. But as soon as those other things were gone, I crashed. And so for me, I wanted to help other people decide and determine what is it that makes me excited about what I do. And when things aren't going well, what can I do to change that? And to help organizations make the changes so that everybody can do that who works for them, so that you have a happy staff and you have people that will stay on and work with you for a long time and not leave. And so that's really where I got excited about the work that I do. So I became a facilitator for retreats for physicians and healthcare workers, and then became certified as a coach, a professional development coach for physicians, to help them and coach them into trying to find more fulfillment in their work.
That's amazing.
Wow.
I love that.
Questions?
I don't know if you've already answered this question. I was just curious, what is the most common, or is there a most common question mark that the physicians or healthcare providers that you work with get stuck at? If you answered that already, let me know.
No. I think it's a good question. I would say that the most common situation that I deal with in my clients is feeling either that I'm already burned out and I'm stuck because this is all I know how to do. My whole identity is wrapped up into being a doctor.
Right.
And everything else in my life comes secondary to that. And that's the way it started from the time I was a pre-med student in college. And it's been that way ever since. And all of a sudden I look around me and I'm not happy. I'm miserable.
Mm-hmm.
And I called my friend across the country and she's just in the same situation. So I don't know if the grass is greener on the other side. I don't know what's going on. I don't know if I need to quit. I'm not really sure what I need to do. And I just need some help because I don't want to make any drastic decision that has this lifelong impact and regret it. So I need to talk to somebody to help me process this. And that's usually the most common thing that I run into.
Mm.
I would say secondly would be the person that sees that coming or sees their colleague in that situation and doesn't want to be in that situation and wants to do something proactively to try to prevent it.
How, I know a lot of people and a lot of clients I work with, one of the biggest things they need help with is work-life balance. I don't want to live to work. I want it to fit into my life. I want, like a lot of what you're talking about, I want to feel fulfilled in everything I do. With people in the medical field, medical professionals, I would think as an outsider, that would be more difficult because the kinds of shifts that you all work are a heck of a lot different than the shifts the rest of us work. So how hard is it to find that work-life balance and what you're talking about of like, I feel fulfilled, I have room to do other things, so I'm not getting burnt out? How hard is that?
I think it is very, very difficult to do, I think, as a physician. And I know that when I went into medicine, my thought was work-life balance isn't going to happen. This is my identity and I'm going to be a doctor and everything will be secondary to that. Mm-hmm. In today's healthcare world, if that's your approach, then you're guaranteed to be burned out because medicine now is so high tech, so complex, and takes so much out of you that you have to learn how to set some boundaries. You have to learn to say no. You have to learn when to turn it off and go home and be able to refill your tanks, because your tanks get emptied throughout the day. And hopefully you can find those things that bring you joy in your job and really allow those experiences to really marinate inside of you and say, wow. So I ask my clients often, I was like, give me an experience that you've had since the last time we met where you really felt really glad that you're a doctor, that you really were glad you were there. And they stop and think about it and think about it. And I said, just tell me a time that you felt like, wow, I am so glad that I'm here in this moment, because that's the moment that you want to try to amplify and replicate more and more throughout your day. So I think that right now, work-life balance, and I just call it life balance because your work is part of your life, is to be able to say, I need to cut it off. I need to go home and I need to be able to kind of compartmentalize my work as best I can so that I can be fully present to the people I love.
Yeah, I tell my clients all the time, no one's going to create boundaries for you. No one's going to create them. Personal relationships as well as work relationships. I mean, people might put their own boundaries in place, but they're not going to put boundaries in place for you. And if you don't put them in first, then everybody starts to have these expectations of you. Like I talk about this with clients starting new jobs, of starting with good habits and good boundaries. And that way you set the tone versus somebody that doesn't have good boundaries and good habits. And then all of a sudden it's like, this isn't working and wants to change it. Well, now everybody's used to the old so-and-so and the way they would work, which probably worked out great for them. And it's harder to make that change.
That old so-and-so.
I couldn't think of anyone's name. I almost said Susie, and I was like,
Susie's a valid name.
It is a valid name.
Well, Doctor, how feasible is that, what you're talking about? Because when I think about doctors and nurses and nurse practitioners, everybody you've mentioned, I don't see them having that freedom to say, going home, everybody, work-life balance. You know? So, and what happens when they can't do that?
Yeah, that's a great question, because I can't say that I was, the expert in work-life balance when I was in the peak of my practice. Some people do it by seeking out positions and jobs that do have external limitations and structure. So a lot of people go into the field of emergency medicine that has shifts, or hospitalists now, because a hospitalist will have a certain amount of time. And when you leave, you check out to the next person and they take over. But it is possible to do in some small ways. And I think sometimes what happens is that we are programmed to believe that boundaries are self-centered, boundaries are selfish, boundaries are for weak people. And the reality is that if we set boundaries, we become better healthcare providers. If we set boundaries so that we can actually say, no, I have to leave at this time to get home to my family, then we come back renewed and refreshed. So sometimes, what's happening now, I believe, is that in order for healthcare organizations to even have any workforce at all, they're going to have to be able to accept boundaries set by providers, because there's already been something like, 21% of the nursing workforce that has left the profession, and physicians will be next. And I think that there's going to have to be external structure, and that a lot of that has to do with offloading the bureaucratic and administrative tasks that providers have. The thing, when I came out of residency and I started my practice back in 1989, the first thing that when I saw a patient and I walked in and I saw a kid and that child had an ear infection, I could open up a paper chart and literally write down left ear infection, amoxicillin, and sign my name. And then there would be a little slip of paper. I circle a number, and then I move on to the next patient. I'm done. That's it.
Yeah.
I don't have a stack of charts left on my computer to answer, because if a parent called in about a sick child, the receptionist would answer and refer to a nurse who's in the office. That nurse would make a decision to schedule that patient or not. If a lab result came in, there would be a nurse that would look at the lab result and then say to me as a provider, this is something that you need to look at or act on. Otherwise, that nurse would call the family and say, oh, the labs are all normal that you were concerned about. If you have any questions, call Dr. Sherman, or I'll have Dr. Sherman call. So there were different people to offload a lot of this extra work toward. Now, all of that gets filtered into this computer screen. And so healthcare institutions, all of a sudden, they've gotten rid of people like nurses and social workers and extra administrative staff to try to take care of those things. So it is very difficult. At the end of the day, there's something like 2 to 3 hours of charting for every hour of patient care for providers now.
Oh,
so you just think of that administrative burden with no extra time built in that you get paid for to do that. It's just expected that you spend the extra time to do that. So that's where institutions can really make a difference by changing that a little bit. Give some space in between for administrative time for providers to do their charting. Have some people that you can offload some of these administrative tasks to. And you're going to have happier people that stay longer in their jobs.
Is there anything? Sorry, did I cut you off?
No, I just took a sigh.
Oh,
Sorry.
okay. Sorry, I didn't mean to cut your sigh off. Is there anything patients can do from our end that can help with anything we've talked about today with physician burnout and, all this kind of stuff?
I hate to put the burden on patients, but I will tell you.
We can take it. Please do.
I will tell you this. If you want better medical care, ask your medical provider how they're doing.
Yeah.
When you go in, and the perfect story, I tell a story all the time, but my wife has migraine headaches and she goes to she's just horrible migraines. And, right now she's doing well, knock on wood, but she went to this headache specialist, and I happen to know this doctor because we worked for the same institution. So I knew who she was, not really well, but my wife came back from an appointment and she said, oh my God, I saw Dr. Smith, and Dr. Smith was like angry at me. She said that I overused the medication and I used too much and it's all my fault. And she was like in tears. It's like, this is not the Dr. Smith I know. And I said, well, let's go in the next visit. I went in too. And she came in and she looked at my wife and looked at me and said hello and everything. And said, oh yeah, how are you doing? And I said, Dr. Smith, there's been a lot of changes. I know that have been impacting me. How are you dealing with things? I know there's been a lot of stuff and a lot of stressors. How's it been for you? And she didn't break down, thank God, but she did. She just started telling me all the different things. They want to move my clinic. They want to move it near this construction area. All my patients have headaches. It's all going to make that worse. And they've taken away half my staff. It's like, oh my gosh. And I just listened to her. I didn't have any answers. I didn't have any ways to fix it. But I listened to what she had to say. That was the best visit my wife had ever with that doctor. So I do think saying something like, boy, I know the pandemic has been really tough on all healthcare people. Mm-hmm. And I can imagine that it's been difficult on you in some ways. How have you been? How are you dealing with it? And that provider may say, oh, thanks for asking. I'm doing okay, but just the fact that you noticed and you inquired, it really makes a difference, that people really know that it's been a challenging time.
Wow.
And I think, because I think when you go to the doctor, you're all focused on yourself. This is about me, which it is, but this is about me and whatever's going on. If I can be grumpy if I don't feel good in the doctor's office, I'll admit.
Yeah.
But I think remembering they're people too. They have bad days. They're experiencing stressors just like you are. And that's a very simple thing that we definitely all should be able to do.
Yeah. I'd say the other thing is when you were talking about going into that office and everybody, he's like, oh, I liked everybody here,
Mhm.
is to say that. Now, if I go in for my medical care, I go to the receptionist and that receptionist is friendly to me and goes out of his way to kind of, then I say, thank you so much. You were so kind. Thank you for your compassionate care. I really appreciate that. Thanks for going out of your way for doing that for me.
Mhm.
And, the bonus is that you get good care as a result.
Yeah.
Right.
But, it feels good to be appreciated. So I think that means a lot. And that's something that everybody can do.
Mhm.
Wow. We could talk to you for literally 5 more hours. I personally would love to have you back on at some point if you would be open to it, because
Sure.
there's so much more. I have 150 more questions in my head that we don't have time for because it's already been like almost an hour. If there are any medical professionals listening to our show, I'm sure there are. I know they're out there and they're interested in what you're saying. How can they get in touch with you or learn more about what you do?
Wow. Thank you so much. I do have a website, joeshermanmd.com. And it's very simple. It's my name, joeshermanmd.com. And there's a lot of information there about programs that I have and resources. Or if you just want to email me directly, joe@joeshermanmd.com. And I'm happy if you send that email, it goes directly to me. I'm the one who answers it. I am a one-person shop right here, and would be happy to answer any inquiries or any questions that people have.
Excellent. We're going to put all that in the show notes so it's available for everybody. Any parting?
No, I just really appreciate you. I appreciate your time and what you're doing, and I think it's really cool how you what gives me pleasure, what gives me joy, and you took that and you made a career shift. I wouldn't say a total change, but to do just in fact that. And you're still continuing to very much help other people and be a healthcare worker or provider by doing what you're doing, just in a different way. Thank you.
Yeah. Thank you for what you're doing. It's really necessary.
Yeah. Thanks for having me. I really enjoyed talking to you.
Absolutely.
No
all right.
So, till next time, Doctor.
Till next time, we're going to have you back. Thanks everybody for listening. And doctor's information will be in the show notes. Like I said, you can send us email. Hey, let me ask something gmail.com. We're everywhere on the social medias. We are not hiding. Come after us.
Yes. Come find us.
Come find us. That's it. Another great show.
All right.
Thanks. See everybody later.
Bye.
Good night.